Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 041. A 34-year-old man complains of pale edema of the face, feet, shins, and lumbar area, elevated blood pressure up to 160/100ths of a millimeter Hg, and general weakness. He has a clinical history of nonspecific ulcerative colitis. Objectively, pulse 84 per minute. Rhythmic, blood pressure 165/100ths of a millimeter Hg. Edemas. All over the body. The skin is pale and dry with low turgor. The kidneys cannot be palpated. On an attempt to palpate them, they are painless. Blood test. Erythrocytes 3.0 × 10⁻12 L. Hb 100 grams L. Erythrocyte sedimentation rate 50 mm per hour. Urinalysis. Proteins 3.5 grams L. Erythrocytes 7 to 10 in the vision field, leukocytes 5 to 6 in the vision field. Daily proteinuria 6 grams. What analysis should be conducted additionally to verify the diagnosis? A. Survey and excretory urography. B. Radioisotopic examination of kidneys. C. Urinalysis for Bence-Jones protein. D. Renal ultrasound. E. Gingival biopsy for the diagnosis of amyloid disease. Ulcerative colitis is an inflammatory bowel disease that causes inflammation and ulcers, sores, in the digestive tract. It affects the innermost lining of the large intestine, colon, and rectum. Symptoms usually develop over time, rather than suddenly. Complications of ulcerative colitis: severe bleeding, severe dehydration, toxic megacolon, rapidly swelling colon, perforated colon, increased risk of thrombosis, inflammation of the skin, joints, and eyes, increased risk of colon cancer, osteoporosis. Amyloidosis is an extracellular deposition of non-branching fibrils composed of a variety of serum protein precursors that occurs when amyloid protein builds up in organs, e.g. heart, kidneys, liver, spleen, nervous system, digestive tract, which can make them not work properly. Secondary amyloidosis is associated with several chronic inflammatory conditions. Examples: rheumatologic diseases, intestinal diseases, familial Mediterranean fever, chronic infectious diseases, e.g. tuberculosis. Although the association of amyloidosis with inflammatory bowel disease is known, amyloidosis secondary to ulcerative colitis is rare. A biopsy can be checked for signs of amyloidosis. It may be taken from the fat under the skin on the abdomen, bone marrow, or an affected organ, e.g. liver, kidney. It can be tested to see what type of amyloid is involved. Gingival biopsy can be used to diagnose amyloidosis, but is less sensitive and may cause discomfort than biopsy at other sites. In the oral cavity, amyloid deposits are rare. But when it occurs, the tongue is usually the most involved anatomic site, followed by the lip. The disease can also present as periodontal disease, and lesions are exacerbated by the inflammation of the periodontium. The answer is E. Gingival biopsy for the diagnosis of amyloid disease.